So Megan Robinson is with our HLA, our lead agency, and I appreciate her organizing the agenda, reviewing it with us, getting things going. I think Sherry was going to join as well, so hopefully she'll pop on, right, Megan?
Yeah, she should be here anytime.
Okay. And then our vice chair of the advisory committee, Anne Marie Winter, is not feeling well. She said she was going to try to be on, but she's not feeling well, and so if she, doesn't pop on, that's understandable. So thank you all for being here. I'm Kathleen Beckman. I'm the board chair of the Continuum of Care and also the chair of this advocacy committee. So I appreciate you being here. So why don't we, I'm just going to read this, our CoC mission and the vision. And then today, as we talk about our charter, we've got a purpose statement in there that's important that we'll, focus on as we open each meeting. And, and, yeah, Megan, I don't see, we have our consent agenda and it's got the attendance. So I don't have attendance on this agenda. So do you want to squeeze it in right before the consent?
Oh, a roll call? Is that what you're?
Yeah, like a roll call.
We don't have an established committee yet, Chair Beckman.
Yeah.
So there's really no roll call.
Okay.
And that's on the list for today.
Part of our charter. Okay. That's perfectly fine. Okay. So our mission is, as it says up here, to coordinate all community partner systems and resources available with a goal of helping individuals and families to prevent, divert, and end homelessness in Pinellas County, the whole CoC. And you all are members of our CoC, and you've chosen to be members and participants in our advisory committee, which meets minimum of 4 times a year, and I'm glad you're here. And certainly our goal is to make homelessness rare, brief, and a one-time experience. So you've got the consent agenda, so we need to approve that agenda in the May 29th meeting minutes and attendance. Do I have a motion to do that?
This is Jody Armstrong. I'm a member of the CoC. This is my first advocacy meeting. I've not attended before, so I'm not part of the committee, so I don't know if I'm allowed to make a motion or not.
Megan, what do you?
Well, I'll move to approve. I think we should be at the last meeting, probably to approve the minutes.
Okay.
Yes.
Okay.
Yeah, technically, there are no voting members.
I know.
However, we can do a consensus vote in accordance with Robert's rules for small meetings. Someone can propose to approve the consent agenda.
Lee, can you propose that?
I propose to approve the consent agenda.
Okay. All those in favor? Aye.
Aye.
Okay. Megan, do we still have that? Do we have that ability to vote on our Zoom here, or is that just when we use the onboard?
Okay. Yes, we do. It's under the reactions tab, which I don't have in front of me.
Oh, I see the green check mark.
The green check mark or the red X. Yes.
Or the red. Okay. Thank you.
It's very good practice.
Okay, it is. It is good to practice. Virtual meetings are just a little challenging. Before we move on to the membership establishment, I wanted to talk about the actions and follow-ups that are part of those meeting minutes. And so we continue to work on, certainly the HLA staff worked on the draft charter using committee feedback, and we're going to discuss that today. We'll talk about the quorum requirements. I'm working at reaching out to faith-based organizations and introducing them to the CoC and encouraging them to work with us in advocacy. So I have had a productive meeting with Faith in Florida, and Dylan Dames is shown great interest in getting engaged with the CoC, and Sherry and I are going to present the PIT report to his organization. I continue to struggle with FAST in Pinellas County, and they have a large membership, and I've reached out to a variety of members and just have not gotten any response. And so if anyone here is part of FAST or is engaged with FAST or know people up at a higher level of FAST that do organizing, and I need some help getting a response from FAST. I know they're real active with their Nehemiah action, which I think is usually in, like, I don't know, it's February, March, April. It's earlier in the year. So I don't know if they taper off for regular meetings throughout the rest of the year, but I want to engage with FAST. And so I'll just put it out there. Anybody on the call today have connections with FAST? No. Okay, I'll keep working. I have the whole list of their membership, and just will, roll through that and start, I've done them in like groups of 3 or 4, and I'll continue to work on that. The other good news about engaging with faith-based organizations is I've had positive meetings with Dr. Joseph Smiley, who's the dean at St. Pete College for Social and Behavioral Sciences. And he's excited about engaging. And he's based at Mount Olive A&E in Clearwater, aside from his being a dean at the college. And he's put me in touch with a woman. I had a conversation with her. It was Friday, is Dr. Tara Newsom. And she's the founding director of the Center for Civic Learning and Community Engagement. Anybody here know of Dr. Tara Newsom? Had a real encouraging conversation with her, and I'm following up with more. Nobody? That's all right. There's lots of good people out there. So, we're going to be meeting them and engaging with them. So that was some of the feedback I had from what the follow-up was. Any questions? No, I don't, we've got the view, so I don't see everybody, but we're good. Okay. So we need to talk about member establishment, and it's part of our charter review. And we've got, so we have minimum requirements we had is you had to attend a meeting, which is pretty minimum. And so committee membership may include any member of the Pinellas CoC. However, at least one committee member must, come from it was, where am I with our membership? Okay. I'm looking at my, hold on. I've got members of, must have, where do I have it? The membership of the CoC Advocacy Committee shall include Pinellas CoC members in good standing. Committee membership will be submitted to the CoC board on an annual basis, and changes in committee composition should be submitted to the HLA staff. We would like our committee to have a representative from the board of directors, from the general CoC membership body. We would like a representative of a funding entity, which can be challenging, and a representative of a provider agency or organization. And this is a representative of, on a lot of our executive committee, and certainly the funders and providers committees, those have people who are leaders, like CEOs of their organizations or higher up in their organizations. And they have a lot of heavy demands on their time. So for our committee, they don't have to be at that high level. They can just be somebody from that organization. And I know that I must have, Sherry, I don't know if you might know
Were there
where-
six people who expressed interest in being members and completed an application, I believe. Yes.
It was an application, and then you had to attend at least one board meeting and submit the application. And the application goes to the lead agency and the executive committee. I must be looking right over it.
Or it goes to the lead
here it is.
agency.
Yep, I see it right there. It's in blue. Yep, I've got it here. Yeah, okay. There it is. Yeah. Yeah.
And so this advocacy committee gets to the officers of the advocacy committee are able to approve.
And that would be Anne Marie and myself. We can name a secretary if somebody wants to be a secretary, but with the HLA running our meetings, and I don't see a real need for a secretary, except for maybe correspondence stuff, but yeah. So the question is, I guess, and Sherry, I don't know if you and or Megan have a recommendation of what that membership application is going to look like. I mean, is it just who are you? Are you a CoC member? Do you belong to an organization? Do you have special skills? All that kind of thing.
There was Megan, there's an application that was created and sent out. Is that right?
Yes, there was. I can put it in the chat.
Yes.
And we did receive 6 people that were interested.
Okay.
Most of which have attended at least one meeting. So that would you like me to name them?
Sure.
Okay. That would be Daryl Henderson.
Oh, good. I know Daryl.
Lee Allen.
Okay.
Ross Silvers. And Kimberly Rogers.
Oh,
so they are all CoC members, and they have attended at least one of the advocacy committee meetings. So they are eligible to be appointed as voting members.
Great. Yeah. Well, I think that's fine. I mean, but so we've got on here that it's reviewed by the lead agency, which is you all, and then Anne Marie and myself, correct? And Anne Marie's not on.
Before being brought to committee for approval. But at this early stage, of course, you have to develop the committee. So
yeah. Okay. Are people all right with that? I mean, that flow of approval? I think it's fine. I know every one of those members and know that they're engaged. They're going to be great members on the advocacy committee. So the next step would be for Anne Marie and I to recommend it, and it would come to the next meeting to be full members.
I don't see any reason. I mean,
or can we do it?
Probably just do it right now, honestly. If there was no concern about any of those members, and then going forward, then bringing forward, because then you would have a membership to actually review and approve.
Okay. Yeah. I'm all for it then.
In the beginning, the early stages is always a little bit, it's interesting. Yeah. Because there's not a committee formed for voting members just yet. But if these were approved, then you would have that. And then moving forward, it could follow that flow.
And it's a little awkward, but I'll ask, does anybody have any concerns or questions or thoughts about this process as we initially get started here with this charter and the membership? Any concerns?
Yeah, Kathleen, I do. I guess you and your vice chair would look at them. If for some reason you had a concern, would you still bring the application to the full committee and note your concerns, or just not bring it forth at all?
I think that's a good question. It'd be interesting to try to understand the concern. I mean, somebody's already got to be a CoC member, right? I would like to think I'd still bring it to be fully transparent about somebody that's applied, and we're not going to recommend it, but to be, forthcoming about that to the committee. I'd like to think that, unless, but I don't know. It's hard to imagine a situation. So can't promise, but it would be in the intention to bring it forward and just say, I do have, Anne-Marie and I do have concerns about A, B, and C or something, and just wanted to let you know, and then we take a vote on it. Okay. So I move to approve. I think that we should approve these 6 applicants who are already engaged with the CoC, and I can vouch for all of them. I know them all, and they're wonderful people, and it'd be great to have them as part of our advocacy committee. So we're building a roster, right? We've got a roster. We need to talk about quorum, and yeah.
Yep. So now
Okay.
there are 6 of us. Great.
Okay. So the others that are on
Someone
the
has
call.
their hand up.
Yeah, who's got their hand up?
I was clapping.
Oh, I'm glad. All right. So Australia and Gary and Teresa and Clara. Are you going to fill out applications? Jody's, yeah. So are people just listening in today and, learning more about the advocacy committee? And you can still attend. It's open for anybody to attend, but please feel free to fill out that application. How can people find the application, Sherry? Or Megan?
I'm going to put it in the chat right now. It is also available on the CoC website under the advocacy committee information, which I will also put in the chat.
Great. Good. All righty. Well, fantastic. So our quorum is 4. Well, I guess we have 8. There's me and Anne-Marie and myself, and then the 6 members.
So there's 4 that we voted in today, and then you and Anne-Marie, so there's 6 in total.
Okay.
So 4.
Okay. All right. So we've got our membership establishment, and then we'll move on to charter review, which is right here. And we kind of started, I read off that part about what the membership is made up of. But if we go back to the beginning, hopefully everybody had a chance to look through this. It's a pretty short charter. It's aligned with our Continuum of Care charter. And I really appreciated the suggestion from, I think MR here is Megan Robinson, but about our purpose. Megan's suggestion is the bottom one that I think is really important, that that CoC Advocacy Committee uses data and research to advocate to policymakers and funders, so that we're based on, stats and information. But I like Megan's is that where it's not just facts and stats, it's people and their stories and their experiences and what they come to us and tell us, whether it's captured in data or not. And I think to our lived experience advisory committee that is looking to educate the public about the nuance of homelessness and individual stories and the complexity, and that stuff isn't captured in a PIT report necessarily, or HMIS data and all that. So if you could take a look at that last, it's right under the or, and give some feedback on what your thoughts are about having it a little more, humanity focused and acknowledging the nuance. And I don't know if anybody's on the phone, but it says the committee may want to consider broadening this language about our purpose to more fully reflect the committee's information sources, such as data, research, member provider input, and the perspectives of people with lived experience. So I'm leaning towards something more nuanced than just data and research. So I'd like any feedback on that. And yeah.
So I don't have any feedback, but I have a question. So, is there any documentation that states that there has to be a charter for COC in Pinellas County? Yeah.
Yes, we have a charter, and it's from housing and urban. It's from the federal level that we have to have certain things in our COC, certain people that make up the COC, and responsibilities of the COC.
Right.
So
Okay.
yeah, but we shape that charter, but it needs to, like, different COCs have different charters, but they all have certain elements that they must have as required by HUD.
Right.
Yeah. Mhm. And our COC charter talks about the subcommittees that we have. And again, not every COC has the same committees necessarily.
Okay.
Yeah. Oh, Daryl.
Yeah, good afternoon. I just wanted to drop in. Lived experience is crucial to any effort of this type. I mean, I work in the recovery space, and you know, providing data is important and it's useful, but it's people's lived experiences that make the difference. It's often hearing someone's story that spurs people into taking action or getting involved. So there really is no substitute for lived experience.
Thank you. Thank you. Any other hands up? Megan, do you see? Okay. Oh, Jody, sorry, Jody.
That's okay. I agree with Daryl. I think that by, excuse me, by adding the two clauses to the existing sentence would clarify that it goes beyond data and research. It clarifies that you're getting input from others and that you are talking to actual people with lived experience, and that makes it a lot clearer, and it makes the group more effective.
Mm-hmm. Excellent point. Yeah. Yeah. Any other, Kimberly?
Hi, everyone. I agree with what's been said, but I think that we can accomplish that by maybe defining data, because when I think of data, I mean, data is qualitative as well as quantitative, and the qualitative data could be, individual stories, testimonials, lived experience. All of that, in my opinion, constitutes data, as long as it's collected and chronicled somewhere.
Mm-hmm.
So I would suggest we keep the sentence as is and then maybe expand the definition of data.
Okay. I appreciate, oh, go ahead, Australia.
Well, it's another question, but it's not about the purpose statement. Do you want me to wait or just go ahead and ask my question?
Yeah, can you jot it down so you don't forget it?
Yep. Yes, ma'am.
Forget. Okay. Kimberly, the only thing I would say about your point about, inserting qualitative as well as quantitative data, I think that's okay in our understanding of what data might be. But I think it's a warmer, more inviting, collaborative wording to say member provider input and the perspectives of people with lived experience, because I think a lot of people don't think about, well, what is qualitative data? And this is more, it's just I think it's a softer wording and more inviting than the one sentence that's a little more scientific. That's all. I just think, we're using the word people, we're using the word member, and the experience. I just think we need to be intentional about being real inviting about our purpose, is about the humanity of it. I don't know. That's just my feedback about keeping it a little softer.
That's a good point. I tend to be scientific sometimes.
Yeah. Okay. That's okay. Anybody else about the wording? And then maybe Are we going to do a consensus or make a motion, Megan or Sherry, about?
I would go through the whole document and then finally make a full, or I would do it by consensus right now. That would be my personal choice, would be if no one else has any issues or input to provide there, then at the very end, when everything is compiled, then doing a motion on the entire charter.
Okay.
That's
Okay.
that's the approach I would take.
Okay. Thank you. All right. Are we good with this section? And then I'll go on to, let's go back to Australia, who wrote her question down. Australia?
Excuse me. Okay. So my question was about the charter in itself. How long have you guys been working on the charter?
Well, we've had a charter. I've been with the CoC for 5 years. And when did the CoC, let's see, start? Anybody here with longer?
I know that the last governance charter for the CoC, I'm not sure if it's the first or not, was in 2020. It was last approved in 2020. And has gone through some updates since then. There have been like 2 or 3 this year even.
Right.
And as far as the charter for this committee, this is a newer, it's a younger committee
Right.
getting formed.
So do these committee, like the meetings that you guys hold, does it determine like what goes into the charter? Because I see like what we're doing now. And this, yeah. You get my question?
Yeah, we're shaping it because it hasn't been in existence or active since I've been here, but it very well might have been earlier, and Teresa Jones is on. Teresa's an expert and has been with a CoC for a long time, so she might be able to weigh in. But this has just been kind of restarted last early spring, the advocacy committee. Okay.
Well, let me start by saying I'm no expert, but I've been around for a while. The advocacy committee as Sherry mentioned, is a fairly young committee. I've not been participating on this committee, but as far as a charter, um, I'm sitting here wondering why there would be a separate charter for a specific committee, but that's just me wondering. But I know that everything that is determined is still got to be approved by the overall CoC board. So whatever is developed here is still got to go through an approval process that codifies it and makes sure that it is in line with the CoC overall charter. So I don't know if that I helped with that answer or not, but
That actually sparked another question. It did, but it sparked another question. So what committees are included in the charter?
Well, we have a, providers committee. We are council, a funders council. We have a systems performance, a data system and performance committee that looks at data and the HMIS input. We have a lived experience committee, and we have this advocacy committee.
and of course the executive committee.
And the executive committee.
And the PIT planning committee.
No, that's a lot of committees.
Well, the PIT committee, in my opinion, I believe it. I don't know if it's in the charter, but it's more of a task force that annually develops how the PIT will be carried out, how we recruit volunteers, and things of that nature. Is that actually in the charter, Sherry?
I don't. Now that you say it, I don't know that it is. So it
Because
may
it's
be.
a task force.
Yeah, it may. Yeah, I believe I think you're right. And in our governance charter, these committees are all listed, and our governance charter does dictate that each committee have a charter. And that so right now we do go through basically where the recommendation by approval of the folks present, then it would go up to the CoC board, leadership board. for
And
final.
Australia, all that charter, the whole charter for the CoC and then the charter for the Providers Council and the funders, all that stuff is on the website, the CoC
Megan
website.
just provide the link to the charter in the chat.
Oh, look at that. She's so efficient. Yeah.
Isn't
And-
that a good thing?
If I may, we did decide to change policies and procedures to charters just for consistency, because we had some committees with one and some with the other. So they're all going to be just called charters now, if that helps.
Okay.
Yep, that answered my question. Thank you, guys.
Welcome. Yep. All right. So we have the objectives. There weren't any comments that people entered in the document. If anybody has any comments, please raise your hand or chime in. I'd say raise your hand so we can call on you. But and then we've got the membership. And if you scroll down to the next or up to the next page, that's where we're hoping to get people from a board of directors would be good. We used to have in there that we required members of the board of directors to join a committee, and there's been some pushback on that. Again, these are the members of the board of directors, are high up CEOs or elected officials, school board members, that people with full-time jobs and responsibilities. So there was a little pushback on that. So we've got strongly suggest. So I'm serving on it now, and Anne Marie Winter is as well. But certainly a representative of the general CoC membership body is wonderful, and a number of you all can do that. A funding entity and a provider agency or organization would be good. And we have a lived experience member with Gary, so that's good. So Gary, you'll need to fill out a a membership application when you get a chance. All right. So the officers are here. Any comments or suggestions here? You can look at Megan's comments here. It's about the election, staggering the elections. I think there should be term limits. Anybody who served and volunteered, which a bunch of you have, I know, once you serve, once you step up and serve in a leadership position, sometimes there's like no escape. So it's good to have some term limits to get different perspectives and leadership and all that business. So I do think we should have term limits, should be included, with a maximum of 2 consecutive. Anybody have any feedback on that? All good, pretty much? I don't see any hands up. All right, okay. Thank you, Australia. Okay. And then the requirements are pretty darn minimal, attend at least 1 meeting, and you've submitted or renewed a CoC membership application and the interest form. Yep. And then we talked about Lee's question. Yeah. Any comments on that part? Okay. All right, good. So we've got the 4 times a year. They're all virtual, and anyone can attend. Members will be able to vote, and then the quorum. So you've got, people have got to attend so that we can move things along and actually vote to do things. All right, Lee, yeah, your hand's up.
All right, quorum. If we're going to require a quorum to make decisions or conduct business, I'd like to change it, instead of 51% or majority. Once we reach 11 members of this committee, which I think we may do so soon, that 11 or more, that only requires minimum of 6 members of the committee to show up to conduct business.
I will
Okay.
say, I believe that this is in the governance charter.
Oh, okay.
So it basically is 50% plus one, because we can't, of course, we couldn't have to do 1% of, that'd
Right.
be a part, your arm will show up and then that'll count. But Megan, do you happen, she's my charter.
I'm gonna
guru,
double check for you right now.
but I do believe that's in the governance charter.
That's for all committees, not just the CoC?
That's what we're checking on that
Okay.
right now, but I do believe I just read that even last week because I ran across it.
So we'd have to amend the governance charter at some point for the committees, because that wouldn't just be for this committee. Any of the committees, I feel like if you had 5 or 6 people show up interested.
I can confirm, according to the CoC governance charter, a majority or 51% of the CoC board filled seats constitute a quorum at all meetings of the Pinellas Continuum of Care board, councils, and committees.
Okay.
No businesses will be conducted unless a quorum is present.
Okay.
So, yeah.
I withdraw my, it goes to another committee.
Okay. Well, and it being virtual, it makes it easier for people to be here. And putting action items at the beginning of the meetings can be, we can be intentional about that, but certainly discussion, having you through the whole meeting for discussion is ideal. Okay.
Thank you.
Just a little question, Megan and Sherry. So since you all are at our committee meetings, can you two be a member of the advisory committee? So as you're here, can you serve as a member as well as, the staff of the lead agency doing the work?
I know that I have a seat on the board of directors for the CoC, but I am not a voting member. So I would not, I don't believe I would count towards it.
Okay.
Teresa? Teresa has her hand
Teresa,
up.
go ahead. Yeah, Teresa.
Thank you. I was just going to say, I think that's asking a bit much of the staff. They already have a full plates to provide staff support, not only to the board, but also to all of these subcommittees. I just think that'd be asking a lot of the staff.
Yeah. Well, I wouldn't want them to do any more work. It would just be like, can you be part of quorum since you're here already? But go ahead, Anne Marie. Oops, Anne Marie, you're muted. There you go. And I'm good to see you here.
Thank you. I sincerely apologize for being late. Thank you very much. One of the criteria for being a member of the advocacy committee is to be a member of the CoC. So I'm not sure staff members are considered a member of the CoC because they're staff of the HLA.
Yeah.
While I think it's important to have the head of the HLA as the staff representative to the committee, I'm not sure they would be counted as a
voting member.
Quorum voting member. And I'm really grateful that Megan is on because she does so much of the work to help us prepare for these meetings.
Yeah.
I'm not sure she would be a voting member. Thank you.
Okay. Good. Okay. So we've got feedback on the language of the purpose, and we've got feedback on the staggered terms, correct? As we get down towards the end of the charter. And the next section is about expectations of RSVPing, and this is just, common courtesy when you're part of an organization or a committee. It's just to let people know if you're going to be here so that if we have to cancel a meeting because we can't get quorum, we're not sitting here waiting and trying to achieve quorum. So, yeah. And then no comment on that. That seems reasonable. Yes, I hope so. All right. And then the roles and responsibilities. These all seem fine to me. Again, whether we select a secretary, if somebody wants to step up for that, and we can see what role. It's certainly not a transcribing secretary for minutes and things like that. But, if we're drafting proposed letters or correspondence and somebody wants to take that on, that can be kind of a secretary role, I guess, if you'd like to. But my concern was a little bit more on as established by the CoC Advocacy Committee, develop an annual CoC advocacy agenda to be approved by the board. And so I want us to think about what that might mean and look like. And, does it mean we look at the point in time results and report and recommendations, and then we kind of come up with a priority list or a game plan, or something that might be manageable for our small group, and present it to the board? Do we look at the boards? The lead agency will, in conjunction with the PIT report and recommendations, and then funders and providers are going to weigh in. We may have a task force group that looks at the recommendations and narrows them down to get kind of a gap analysis of where is our community, where do we need more help, more support, more engagement, and then is the advocacy committee going to work on that kind of a thing? So how do we see that sentence? What do we see that looking like? And do we want to weigh in?
I can add one more just idea to throw out there, and that is the Florida Coalition to End Homelessness. All the CoCs statewide get together. They just have their membership meeting, and each CoC gets to vote on that, and they establish their legislative priorities. And so that would be something to consider as well, as well as local areas that we need to address.
And their legislative priorities at the federal and the state level?
It's mostly state, I believe, is what they could go beyond that, but it is state.
Okay. Right now. Okay. Oh, Anne-Marie.
Yeah, I agree with Sherry about that. I think it's really important for all the CoCs to be kind of lockstep on issues at the state and federal level. And so we all want to be working towards that, and the advocacy committee can really help to make sure that that happens.
Okay. And then we can use our data from our PIT and all our specifics for Pinellas County and funnel them in through that.
Right. So you're basically meeting with the local legislators, but you have your general talking points, because the general talking points are the legislative priorities. And it's usually funding or policies that are going to help mitigate those experiencing homelessness. And then you take your data and stories from your local PIT count and stories from, the reports from your providers to create kind of your one-page leave behind that you talk about in your meetings and then leave with whoever it is that you're meeting with. Could be one of the ways that the advocacy committee contributes to advocating for the legislative priorities of the CoCs statewide. I wanted to mention about the recommendations that came from the PIT count. So I kind of see that as the responsibility of all of the members of the CoC and all of the committees, but really coming out of the executive committee, right? Because the executive committee, as the officers of the CoC, kind of look at those recommendations and determine the direction that they will present to the board. And then each of the committees take on whatever their role is specific to that. So I think there were like 7 recommendations this year with
Yes,
strategies.
Yeah.
Yes, 7 with a bunch of,
Right.
some,
So I bet the executive committee is going to kind of look at them and determine, okay, which 2 or 3 or 4 do we really want to focus on? Because 7 is a lot, right? Most of us have other jobs.
yeah,
And we want to do a good job as a board member of the CoC or as a member of the CoC. But 7 is a lot, right? Because they each have their own strategies and tasks. And
yeah.
so, maybe the executive committee will choose a certain number. And then the advocacy committee can look at those and say, okay, where does advocacy play a role in each of those areas?
Mhm.
Could be one of the ways we look at this.
Mhm.
Thank you.
Sure. Yeah.
I want to just anyone while you're reading the PIT report. So we were a lot of recommendations, and honestly, they were best practices. I believe that Freeman had pulled, Dr. Freeman had pulled, and one of the things that are happening right now is just some of the areas we know we're already doing. And he of course does not have that granular of knowledge to know that what's happening throughout our entire CoC. And so, because it was a list of best practices and not necessarily related directly to all the data that was presented in that report, we are going through right now with some committees, the providers and funders especially first, just to do what are you doing? We're setting up a survey actually this week, or it was
Friday. It went out Friday. I think
it
it went
came
out.
out Friday. That's right. It'll be due this week.
Yeah.
So if you received that survey, please complete it.
Mhm.
So that will help inform what we're already doing, and so we can ensure that in the strategic plan, when the executive committee gets together and is looking at this, what areas we don't want to throw away what's working well. Of course, we want to keep supporting that or maintaining at least or even improving on. And if there are other areas where there are gaps, then that can be part of the strategic plan. But there were a lot of recommendations, and I do have to, I keep on, this is the drum beat that I keep stating. They do not necessarily reflect a gap in our system, those recommendations. I just want to say that there should be a big asterisk somewhere on that report that they don't necessarily reflect that.
Right. But it'll be good as the funders providers are going to be looking at that, next week at their next meeting. What do we do? And, kind of editing it down. It's before it comes to the executive committee, and it's a good way to look at that, and it's a good way to know what we are doing and what's working well, as we look at those. Anne Marie, sure.
Yeah, and Sherry, to your point, I mean, that's great for strategic planning, right? Because it's okay if you've done some of the things that the report says, because in your strategic plan you can say, okay, we have met or we have exceeded this goal. So, and the PIT count report is the data to show that. So I don't think it's a bad thing that there were 7, especially if some of them have already been accomplished. But hopefully there are a few more that we can all work on.
Yeah.
Oh yeah.
Okay. So how do we feel about that sentence? Develop an annual CoC advocacy agenda to be approved by the board. And what time of year do you think that would fall in? And, Sherry, you said, is it the Florida Coalition to End Homelessness that has their legislative priorities?
Yes.
Yeah. And so have they come out with them for 2026 for that session? And that session starts in March, or is it earlier? Do we know?
It starts in January next year, which means, sorry to interrupt. I didn't mean to.
No, good.
It's different every year, and this one went on for so long.
Yeah.
But it will be January 2026 through March of 2026. So I can't remember. It's like the second Tuesday or the first Tuesday of the year. But it means that committee meetings start in like October or November.
Okay.
So I'm sure the statewide association is now working with our lobbyist, Brian Cherry at Pinpoint,
Mhm.
to come up with those priorities.
Yep.
And some of those priorities may include funding.
Mhm.
So my suggestion would be not to give it a date, because every year it's going to be different, right?
Right.
It's going to be,
Yeah. Yeah.
but something that gives us some flexibility so that we can review those, we can have a meeting to review those legislative priorities and present them to the board with whatever else it is that we want to do.
Mhm.
Um,
We'll probably present them with our one pager, I would say, right? That's what we could communicate to the board of directors, the executive board of directors is like, this is what we have. This is the legislative priorities from the Florida Coalition to End
Right.
Homelessness. This is the Pinellas specific one pager that we're in alignment statewide, but this is our Pinellas specific numbers.
Yeah.
And we want you to know that this is what we're going to go forward. We would like to go forward with.
Yeah. And
Yeah.
if Pinpoint does for Florida Coalition to End Homelessness is what they do for us, is they basically create that one pager.
Okay.
And then you're dropping in your data points.
Got it.
I also remember, Kathleen, something that was important to you and we decided, I think, was important was the faith-based community. So that's not necessarily a legislative priority, but it is something that I think we said we wanted to work on.
Yes.
So it wouldn't necessarily just be that executive summary one pager, but it would be that plus anything else we wanted to work on.
Right.
Right. But
yeah. And I think if we said, go ahead.
No, go ahead.
No, you go.
So if it said like something in time, prior to the start of the legislative session, something like that, so that it gives us some flexibility.
Mm-hmm.
But we definitely wanted it to be way before the legislative session, because Sherry, you're going to know this, right? And most of the people on here, it's like those committee weeks are super important. That's when you're actually going to have a chance to meet with your legislators before they go up to Tallahassee for 60 days.
Mm-hmm.
So, and we want to have it ready in time for the legislative delegation meeting, because whoever's going to be presenting their 3 minutes of fame, they're going to, we're going to want to make sure that the board has approved whatever it is that we're saying.
Right.
And believe it or not, I just got notification that some of our South Florida delegations are already setting up those meetings. Like Palm Beach already has its first meeting set up. So,
for the legislative delegation already?
Yes.
Like set for November, early November, or they're not.
I have to look at it, but our lobbyist sent it to us, and I was like, oh my gosh, I'm gonna have to start looking at Pinellas and Pasco now.
Okay.
But again, just so
Anne Marie's correct. In the election years, it's 2 months earlier. So next year's an election year. They want to get out of Dodge by March.
Yeah.
So
gotcha. Is that why it is? Okay. Yeah.
Yep.
So again, just to give us enough time to prepare something that we feel good about, that can go before the board, that we want to, do a press release or present to the delegation, have ready for your meetings.
And as we work on that, so as we look at the legislative priorities of the Florida Coalition to End Homelessness, and we get it into a one pager, whether they provide it or we create it, we have our Pinellas data. If we need to call a special advocacy committee meeting to all of us approve of this one pager that we want to present to the board, so that it's not just, so that we all are presenting it and approve it. And we can do that in between if we need to do it like before September or October. So we'll just give you a heads up and have a quick, we even like a half-hour Zoom meeting to say, this is what we've got developed. What do y'all think? Are we missing anything? Okay. Especially if they're going to be meeting in October, November, which I'm sure they are. They're not going to be having a legislative delegation meeting in December, I bet. But yeah. Okay. All right. Any other further feedback on that charter? We doing on time? Let's see. Okay.
I have one question. I may have missed it, but as far as voting goes, are votes allowed to be done electronically, or do we have to have a meeting? Is that in
I think our charter allows electronic voting for the board of directors, so I think it certainly can be electronic here. Don't you think? Yeah.
It's in there.
Oh, it is. Okay.
But each group gets to determine that for themselves. I wanted to make sure that way that what you just made, you reminded me when you mentioned.
Yeah. Okay.
Yeah. So we may not need a meeting. If we prepare
you mean via email.
prepare
That's
the
right.
document, we can send it by email and vote that way.
Yep. Solicit some feedback and then have a deadline and then vote. Okay. Anything else? So we do need to, by consensus, approve of our charter language change. Is that correct?
I'll make the motion.
Okay. A motion by Anne Marie and a second. How about by one of our four that got approved today? I can second.
No, you shouldn't second, Kathleen.
Okay, go ahead, Lee.
I'll second it.
Thanks, Lee.
The strict Robert rules, you should not second.
All right, thank you. All those in favor?
Aye.
You can vote with the reactions if you want. Yeah. Okay. All righty. Any opposed can vote no. So good. All right. Megan, you clear those votes out, right? You're able to clear them out? You must have been.
Yeah.
So I didn't take mine away. All righty. Okay. So Sherry, you're going to give us a update on legislative funding.
Yes. So this group had created a one-pager and went out, shared it with our legislative delegation to encourage maintaining staffing grant funds and from the state, as well as challenge grant and a number of other just funding asks from the state. And I want to say that we did have a wild ride at the end. The state fiscal year ends June 30th. And so June 30th is when the governor finally approved the budget. The very last day is literally the one job that they have in Tallahassee. So they get to check that off. But it was a much more delayed vote than our approval process than we typically have here in Florida. And so I just wanted to say that DCF was very much on top of it and was able to get those contracts out to the lead agencies because we receive fundings, the state unified homelessness grants that are then dispensed across, with our subcontractors. So they're CoC approved. So we have emergency solutions grants funding. We have challenge grant funding. No challenge unsheltered right now. That's one of the things that is actually on the legislative agenda for the FCEH that I mentioned earlier, the Florida Coalition. There does appear to be some wrapping up of that challenge unsheltered into the challenge grant so that we can actually, when we say challenge grant, we don't get confused about is it the unsheltered or is it the other challenge? So that's good. So just wanted to give that update that we were able to go ahead and send out subcontracts and not with smooth transition and bill retroactive to July 1st without providers having to pause services. So that was really, really good. The other thing, just to watch out on the federal level. So I've been seeing this for a while. The state, we have a lot of allies for the CoC program. The federal government right now is more concerning. And so I'm going to share actually in the chat an executive order. that came out if you haven't had a chance to see it. And so there's the executive order. Make sure that you've taken good care of yourself before you read that. And it's been we're learning that the Cicero Institute is behind it. And so if you go to their website, I'm not going to Cicero Institute. There we go. If you look that up, if you go to their website, it's very obvious that they did feed the language into this executive order, and they even have model legislation to go to states. And it mirrors the anti-camping bill. It also talks about civil commitments. So we have Baker Acts. I mean, there are things in Florida that already do exist, but there are more protections around that. And with the executive order that came out, it's like wanting to get rid of housing first, force treatment and for behavioral health and substance use disorders. And I want to just caution that when you read local news reports, and there are even some COCs that are starting to embrace this, so that's a topic discussion. But the reporting is, I would read the primary source material. It's brief, and stick to that. There are, discussions about having more access to treatment services, but really this is about criminalizing homelessness. The way it's talking about ending crime and disorder on America's streets. That is the title of this executive order. So while that's happening, the Transportation and Housing and Urban Development Appropriations Subcommittee, or committee, sorry, have been meeting to determine how much money appropriations committees, how much money is going to be going towards HUD and the COC program. And the administration and the federal government had put out there that they wanted to roll the COC program into the emergency solution grant style state block grant, which is very limiting, like 2 years limits to housing assistance. It's more crisis oriented. After some advocates, or folks started screaming about that, what about permanent supportive housing? Then there, was some talk around people who are aging or people who have disabilities, because that's primarily what those supports provide for. But we haven't seen, from the administration what that would look like. So the good news here is that did not, the House even, which tends to be more aligned with the administration, even more so than the Senate, both the House and the Senate rejected the idea of turning the COC program into a state block grant. So that's one thing. They also did not follow the administration's budget proposals either. So for a lot of the housing programs. And I think all this is surprising. It's just kind of like we're taking it day by day, and like, what's going to happen now? You never know. And then finally, the administration had put for a 50% cut to the HUD department, and which is where we receive a lot of funding, where we get a lot of our technical assistance. I can say that just last week, we met with our technical assistance provider from HUD. There was a stop work order that happened back in January, and we have not been able to meet with her at all. And anytime we needed technical assistance, we had to pay for it. It wasn't being covered anymore. And it was very brief and limited. So now that is back in full swing again. There are some changes that are happening around language, of course, and what the priorities are and what can and cannot be discussed during technical assistance or in applications or in contracts. But we did get that back. And so instead of the 50% cut in staff that the president had put in his proposal, I know the House was at 28%, which is basically what the current vacancy is. So that's just a quick update on funding and some things to watch at the federal level right now, because we did get what we needed, and we even got additional funds, quite a large increase in what's called, oh goodness, I did this, rapid unsheltered survivors housing rush funds. It's basically emergency solutions grant funding. So it could be used for, in our COC, for rapid rehousing projects, for prevention, and for emergency shelter. And so that's really good, but it doesn't come back year after year. We get that because we were impacted by disaster and by the hurricanes. And so we can expect to continue receiving those funds, but we never know how much. And it's always a thing for providers, you can't staff a program if you don't know if the funding is going to still be here. So it pretty much goes to existing programs to help supplement what they're doing already.
That was a fantastic overview. Good news at the state level for the continued funding, and worrisome, but we'll see what the federal stuff happens. Any questions on Sherry's update? Okay, Anne-Marie.
I just have a comment, and I want to thank you, Sherry, for your leadership and that of Kathleen. These are very difficult times. We are all in this together. We all have to support each other. Because if me today, you tomorrow, we are seeing this from all sides at the federal level. We have to keep up our advocacy efforts and just make sure that our elected officials really understand the consequences of their decisions and how this is just going to severely impact the fabric of our society. So you're not alone. We're in this together. Thank you for all that you do.
And thank you. And it's true. And also being able to stay on top of it, to parse fact from fear, the hypothetical. We have to plan for all kinds of things, but we can't plan for everything, right? But know what's rumor and what's real.
Thank you. Okay, I have agenda item 6 is the Lived Experience Advisory Storytelling Initiative. And there's a link on there about Your Story Matters. If you've linked on that, it's a number of questions. I did not develop those questions, but and I'll give just a brief overview, and then if Gary wants to speak, or is everything's working out okay there. Gary has some hearing issues today, but so the Lived Experience Advisory Committee that I've attended a number, I think the last 3 or 4, but they're looking at wanting to tell more of a nuanced, real story of what it means to experience homelessness, recover, become, move out of homelessness, just the whole spectrum of an experience of people who have experienced homelessness. And part of that is to tell a story. And they talked about telling a story at maybe a city council meeting. They do have a member, Jennifer Haythcock, there, who has spoken before the Clearwater City Council a number of times. And you're only given a certain number of minutes at a public meeting like that. And so they talked about practicing or different types of story, how you could tell your story in certain ways. And there was a lot of excitement and interest, but they've yet to put that topic on an agenda to really work through it. And I'm a former high school English teacher and had offered that I could help lead kind of a workshop in at least exposing people to different ways to tell your story in 3 minutes. And they expressed interest in that. And I think there's a comfort level, but again, it's got to get put on an agenda for a Lived Experience Advisory Committee meeting. And so once they do that, that's what we can do moving forward, if they continue to have an interest in that. And the Your Story Matters questions, I think the HLA developed those as just kind of a start to think about what you might want to talk about or your comfort level. Is that right, Sherry? I didn't know if Victoria did that or Megan did.
I believe, yes, this was a project of Victoria's.
Okay.
But
it has not moved into action on the committee yet. And this is where maybe Gary can jump in. Gary is on the executive committee. Is he, Gary, you're co-chair of the Lived Experience Advisory Committee, right? It's like not vice, it's co-chair, I think.
Mhm.
Gary, able to hear us or speak? Just don't know. I think Gary's still on. No. Oh yeah. Gary, can you hear us? You're on mute if you can chime in here at all. We did have one of the members, Jennifer Haycock, just to, flesh this out just a little bit. So Jennifer Haycock is a member of the Lived Experience Advisory Committee. And she was going to be on a local radio show. It's called the Kelly Show. It's based in Clearwater at like Tan Radio or something. It's a small community radio station, but Doug and Kelly interview people about local goings on, and she was going to be on there, and something came up just to talk about homelessness and her journey, and to put some nuance and let people know that there's everyone has a story and it's different. So we can reschedule that, but it was another way to tell a story. So that's the update on the Lived Experience Storytelling Initiative. I think it's a good one. I think there's a lot of positive energy in the room. We just need to get some momentum to move it forward and get things started. And, there's not a huge rush, but it is a valuable part of telling a story. And, elected officials need to hear it at all levels. So I guess, yeah. Anybody have any comment on that, or any experience with working with people to tell a short narrative, in a 3-minute blip? Okay. Well, I'll keep you informed about how that goes. And if you want to take notes, there's again, I used to teach the book, The Glass Castle, at the sophomore level. It's a nonfiction written by Jeanette Walls, who grew up in extreme poverty in Welch, West Virginia. She was born, and then she traveled. Her parents, took the children throughout the country, and it was really some really harrowing experiences. And she wrote this book, and I taught it. And part of the activity was reading this piece by John Scalzi, Scalzi. He published it in the Chicago Tribune. I was teaching in Illinois at the time. And it's just called Being Poor Is. And all it is a series of sentences. And it is profoundly impactful. It was to me and my students. But it's just a neat example to look at how you can communicate the real humanity of people's experiences without being preachy. They're all just declarative statements, and it's pretty powerful. So that's my update without Gary, but I know Gary would chime in if he could. So he's been a good leader in that Lived Experience Advisory Committee. Okay, so the next thing is the engagement of faith-based community partners. Again, I mentioned that kind of at the beginning. I'm struggling to get engagement with FAST. I will continue to reach out to different leaders in that organization. There are a large number of multiple faith leaders throughout the county. Faith in Florida has been more receptive, and Sherry and I are going to present to that group in September the PIT results, and kind of introduce them to the CoC and what we do and how can you play a part in it. And I think, and Sherry and I have, and this is along the lines of advocacy too, a list of organizations throughout the county that we've asked to present, a 15 to 20 minute overview of the PIT report, and just to inform people. And minimally, a good goal could be, please join us in our PIT count in January. We were over 100 volunteers short this year in 2025. And we want to make sure we maximize the number of volunteers we can to spread out throughout the county and get the best picture possible. So, and then my interactions with Dr. Smiley and that other woman was really positive. So she was in Michigan. She and I are going to set a time to meet. But I told you her name, and it sounded real positive. So she's a doctor something. Dr. Tara something. Really good. So that's my update on the faith-based interactions. Oh, go ahead, Clara.
Hi. So
Hi.
regarding FAST, I've been able to talk to a few people while we've been doing this meeting, and I was able to get a phone number and email for someone who's currently with FAST, as
Okay.
well as contact information for someone who used to be an organizer who might have more updated information of current organizers for them as well.
Okay. Do you want to email that to me or Sherry? Or, you can email it to the HLA and they can forward it to me.
Okay.
I have like Secretary at FAST. I've tried that one a number of times, but yeah, share with me whatever you have and I'll
Yeah,
reach.
I have a phone number for a reverend with United Methodist, and then I have contact information for someone who works with the organization, but they also work at Verizon. So I have two
Oh,
different ones for you.
that'd be great. Thank
Yep.
you. Thank you.
Mhm.
Okay. All righty. So more to come on that. I feel positive about it. It's just it just takes some time. So Sherry, do you want to lead us on the takeaways from our point in time count report? Yeah.
Some takeaways. Well, we did have the lowest number. There has been a lots of asterisks, going to tell you. But so since 2016, the data that have been collected have shown a steady decrease in the number of people who actually participate in the survey. I'll say it like that. And there could be a lot of reasons for that. But I know that ever since when we look at our HMIS data, so that's information that's put into our homeless management information system. And so all of the providers do that. And it's ongoing information, of course, not one night, or one day. That there has been after COVID, during COVID, a lot of people who were unsheltered before. Look, it's like they left, and we don't know where people went. So that was a big point where there was a drop. Uh, what we know is a few things. We know that we have the anti-camping legislation that came out. And so there were, people undoubtedly would have been afraid of sharing where they slept the night before. More people, based on, information we received back from our lived experience advisory committee, is that there were folks who are going deeper into hiding so that they will not be picked up. And another thing is, like Kathleen had mentioned, there were over 100 fewer volunteers. So roughly 400 volunteers last year and 300 this year. Impacted by the storm, people were not able to, two storms, Milton and Helene. And so we had that issue as well. And then finally on the potential things that would affect the number in a way that it wasn't because of successes, was with the storms. FEMA came down, and of course we had the vouchers for hotels, and so we have not seen a lot of people leave who were unhoused before leave hotels and come into our coordinated entry system. We haven't seen that tsunami. We've done a lot of work with FEMA trying to get data. The county's emergency operations center has done that as well. And it's something we've all worked on together with some technical assistance from HUD, and we have not been able to get the information, but we have not seen an uptick there. So the other side, and of course, it's very difficult when you do evaluations, it's very difficult to prove what is the actual reason behind a certain event. The other side is that there were a lot of funds related because of the anti-camping bill, I would say. They came down for emergency shelters to expand, and for more services to be provided. I know that within our CoC, just within the CoC, not City of St. Pete has increased funding, like to Pinellas Hope. Safe Harbor received funding to increase their case management staff and their clinical staff, and so that it does some good work to help people stay like move and get more successes in the system. But I know with HLA, with the CLC funding that we received from the state, that there was significant increases over the last year and a half that have come down from the Department of Children and Families. And so, especially with challenge funding, it went from like 150,000 at some point years ago to now it's close to $1 million. It's like $750,000. And so, and then the challenge unsheltered, of course, was close to $400,000. So that could also play a part. There's also a lot of funding that went into prevention. So whether it be from the county or diversion from the county and prevention from a challenge grant, those funds help keep people in their homes and from entering into the crisis system. So that we did see. We did see, though, an increase. It's important to look, if you ever do look at the report, to look at the numbers next to the percentages, because if it's a small number, the N is small, and it goes up by 1, it could look like a really big increase. So if you have 2 people, but then it turns to 3, that's a 50% increase, right? It's 150% of what was there last year. So that, keeping that in mind, we saw that seniors, and this checks with the data that are collected in HMIS, and that the Data and System Performance Committee talks about every month and during their meetings, that age group of 62 to 65, and then the over 65 group makes up a really big. We saw an increase there from last year's point in time count, and we do know that is a large subgroup of that we focus on because of the number of folks who are affected, as well as veterans. Kathleen, did you want to share some more?
No, I mean, I think I like the way you covered the nuance of the numbers as far as why they might be lower, according to some of the, negative things that are going on out there, but also some of the positive things that are going on. So we do want those positive things to continue. One of the other positive things I think is the county level are the medical vans that go out, the mobile health units that help connect with people. And I think those people develop relationships that help them be more successful and, develop a comfort level with people. And hopefully they'll, when housing becomes available or things get into alignment, that they can move into housing and be successful. So I think those relationships are good.
And I think that, depending on your audience, of course, I mean, with the audience, being honest is good. It is. So that was an honest, here, yep. It could be this, it could be that, it could be a combination of things, right. But we do know, we know, and all of it is probably all connected. When we have these lower numbers, though, and we can say, hey, look, and we use funding and we have programs and services, that shows that it works. Yeah. As well. And so, and no one's going to fund something that's not working. Or, I mean, at some point, it's like, why are we still funding you? Right. So with the conversations that are happening at the federal government, or even locally, making sure that's out there.
And
that
yeah. Any comments on the PIT report? I'd strongly encourage everybody to read it. It's long, but the big majority of it are some graphs and the data. It's got a nice overview in the beginning and a discussion at the end, and the recommendations are pretty interesting to read. So that as you read the recommendations or the summary, then you can flip back and look at the actual data and what are we seeing? How prevalent is it, or whatever? So please do look at it. It was a lot of work, and our PIT report is so much richer than a lot of other COCs because, number one, we do it annually, which it's only required to be biannual or every other year. And then we include some data from Safe Harbor, our quote shelter, but not really jail diversion in the Pinellas County Sheriff's Department, as well as the Pinellas County schools. And I'm telling you that data from the Pinellas County schools is really important to have in our PIT report, I think, because there are a lot of children and families that are affected, and, you know, doubled up and couch surfing and all of that. And I think they're not going to be visible out on the street on the day of PIT count because of 100 different reasons. And fear is a big one. But I think it shows us that the schools, the public schools, so these aren't charter schools or private schools, it's just the public schools, you know, people feel safe enough to let others know that I've got a problem, and is there anyone that can help me here to try to secure some safe housing or get us over this hump or whatever. So I'm really appreciative that our report includes those two other data sets that many others don't. So any final questions on that PIT? It'll help inform our strategic planning and our gap analysis. And as we talked about with, you know, Anne Marie with the Florida Coalition to End Homelessness and the legislative priorities, plugging in PIT, you know, Pinellas County specific data, maybe using some narratives and personal, it all fits together for our advocacy. Yeah. All right. I'm not seeing any hands. So I'll ask, is there anything else anyone wants to bring up or discuss or comment on, suggest for future meetings? Anything we're missing that's going on out there? No? All good? Okay. Well, thank you all for being here. I really appreciate it. And I appreciate, you attending and lending your voice. And I encourage you, if you haven't filled out an application to be part of the CoC and this advocacy committee, please do. If you can't afford the the CoC membership, we have a sliding scale. We have applications. We have, scholarships. We can help you out. Don't let money be, a deterrent at all. We will make it happen. We need you at the table. So with that, I will adjourn the meeting, and I hope you all stay cool and hydrated, and have a good week. Take care.
Thank you.
Thanks, Evan.
We have a membership and we have a charter.
Yeah.
To go to the board. Yes.
Bye-bye.
Bye, y'all.